Well, a warm welcome to today's talk, Tuesday the 7th of December. Now, 7th of December today, probably by the 25th of December, I'm going to be exposed to Omicron and you're probably going to be exposed to Omicron. If not, then I'd say within a month after that. This is going to go around the world now fairly quickly and fairly dramatically, and is doing so already. Of course, in a minute, we're going to give evidence for that. And basically, the world has not taken precautions to stop the spread of Omicron, that anything like necessary to prevent the spread of this massively transmissible Omicron variant. Therefore, it will be with us. So I'm hoping that the predictions that I've made and that others are starting to speculate are true now, are true, because if not, we're going to be in trouble. If this is making people sick, we are going to be in trouble, because it's going to be everywhere all at the same time pretty soon. But I'm still very optimistic, although of course we don't know for certain yet, but I still remain optimistic. But anyway, enough of my speculation. Let's get down to what we actually know. I think we'll just start off with a bit of orientation today, actually. So daily confirmed COVID cases per million. Now, Japan has got virtually no cases. Why is the pandemic over in Japan? We are all immensely jealous. India, there's some underreporting, but cases are low, genuinely low. Now, South Africa, we see the uptick that we know about. Then it's the United States, United Kingdom, Denmark with a sharp increase, Hungary and Ireland down a little bit there, but I think we can expect those to carry on going up, as we'll give evidence for shortly. Netherlands, Belgium and Slovakia, really quite high numbers of cases being reported there. Hospitalisation, well, again, this is very, very significant. So we've got countries like Hungary, Slovakia, Belgium. Slovakia and Hungary, we do know the significant problems. Czech Republic, other countries, we know the significant problems with hospitalisations, putting a real strain on services. And it looks like this is still Delta-driven. This is still mostly Delta-driven as far as we know. Belgium, cases going up, then the United States, Netherlands, Ireland, United Kingdom, Denmark, Canada. So remember, that was patients actually in hospital. Now, going on to the proportion that is the proportion here that is Omicron. This is not up to date. Well, I've just downloaded it. Obviously, it's as up to date as I can get it. But we know it's not up to date from our world in data fully, because, for example, in Denmark, we do know there's quite a lot of Omicron in Denmark already. So let's just look at that, bearing that in mind. So basically, up here, Slovakia, we don't really know. Denmark, we do know there should be a fair bit of red there. We know that for certain. United Kingdom, well, we've just got a little sliver. Ireland, India, Belgium, Netherlands, Canada, United States, South Africa. And the 84% in South Africa is a minimum, actually. It could be even higher than that now. And as we say, Denmark, we know for sure Denmark has got a higher proportion of Omicron than here. Now, in terms of what this is doing to reproductive value, this is the one line here. So anything below there, the cases are falling. Anything above there, increasing. Let's just go in and look at that if we can. So bear in mind that this is the one line just there. So we see that India cases are falling. Japan there. Japan, actually, they're just pretty well level there. But everywhere else, cases are going up. That's the one line, remember. Anything above the R value of 1. Cases increasing. So Slovakia, Denmark, Canada, Hungary, Belgium, United States. South Africa, well, that really does speak volumes about the level of increase of cases in South Africa. New daily confirmed cases per million people. There we see it. United Kingdom, South Africa, United States. We are going up. South Africa very clearly going up. And as we know, South Africa is entirely Omicron driven. The cases are going up really quite dramatically. And in the UK at the moment, we will come on to this, but in the UK at the moment, we're probably looking at Omicron numbers doubling every 2 or 3 days. So this is how quick this is. Anyway, let's get on to some firmer footing. Sajid, Javid, community transmission of Omicron, UK Health Secretary, of course. It's in multiple regions of England with no links to international travel. In other words, we do now have community spread. 21 cases in Omicron linked from travel to Nigeria. So again, we see that this has been spreading in Africa. So if there's 21 cases in England from the limited number of people that have flown into England from Nigeria, I don't know what it is, it's probably in several hundreds. It means there's a lot of Omicron in Nigeria. This has already spread throughout Africa. It's just that it's not being picked up because the surveillance isn't good. So this means pretty well for certain there's a lot of Omicron in Nigeria, unless it just so happened that all the people that have come from Nigeria to England, or 21 of them, had Omicron, which isn't very likely. We can say it's widespread in Nigeria, a massively populated country, of course. Cases, so 90 new cases in the last 24 hours, 336 altogether in the UK. This, of course, is now out of date. By the time you watch this, this is out of date. I have just checked this before we've recorded, but it's going to be out of date. No hospital admissions related to Omicron at the moment, as far as we know, or rather as far as the Secretary of Health knows. I mean, it's looking good. It's looking good, but if it's not, we're in trouble. So let's hope this keeps up. I believe it will. Although there is a proviso that we'll look at. Could not guarantee Omicron would knock us off our road to recovery. Direct quote. So still unknowns there, according to Mr. Javid. Incubation period may be shorter. So typically we're looking at an incubation period from infection to first symptoms of 4, 5, 6, 7 days. It looks like it's shorter on this. There was some speculation that Delta would be shorter, but it still seems to be around about 5 days as an average for Delta, 5 to 6 days. So it looks like this could be shorter, a shorter incubation period from exposure to becoming symptomatic, or to be have developed enough of the virus to be infectious, to be transmissible to other people. So a person will become infectious sooner, obviously. Omicron to become dominant in the next few weeks, as we've said. I'm expecting to be exposed by Christmas, if not earlier, just from routine, necessary life. And that is taking precautions, of course. UK response, 10,000 vaccinators are being recruited. Pity we're not going to do the vaccines properly with aspiration. We'll be looking at Denmark in a minute, where they are, so that's encouraging. If the Secretary of State would like to contact me, I am more than happy to train vaccinators up to do it properly, as are tens of thousands of other nurses and doctors around the world who know how to aspirate. We are happy to train up cohorts who can train up cohorts. Just let me know. I don't expect it to happen because they don't want to. I don't think they want to admit they've been wrong all this time. I think that might be what the problem is now. 450 military personnel coming to help. Pre-departure tests. In other words, if you're coming from outside the UK, going back to the UK, you have to have a test before you depart your port of departure. We've got red list countries. We've got masks. People are wearing masks in shops and public transport. This is happening. Seems to be universal again now. Omicron cases require to self-isolate for 10 days. So anyone who's come into contact with Omicron will have to self-isolate for 10 days, regardless of vaccine status. What this means is, for sure, in the next few weeks, we're going to have a massive pingdemic and everyone's going to be off work because everyone's going to be exposed. They're going to have to rethink that, or be prepared for major economic and employment consequences. UK Health Security Agent doing 500,000 tests a day. Fine. Dominic Raab, who's now our Deputy Prime Minister, we believe. Plan B not required because of success of the vaccination programme. Government is taking targeted and proportionate approach. If he's wrong, how can I put it? We're stuffed. If he's wrong, we're going to have people dying in the street outside hospital. I don't think we are, but they're taking a heck of a gamble. But there's no political will at all to try and stop this variant. I'm not saying it's right or wrong, I'm just saying what is happening. That means it's going to be everywhere. Let's hope I'm right about the low hospitalisations and deaths, although we don't know yet. but the sheer numbers could be a problem. Now, Denmark, as we saw, Omicron, 183 cases confirmed on Sunday, triple the Friday estimate. So again, we've got a doubling time of every 2 or 3 days in Denmark, and we do have community transmission in Denmark now. Is Denmark a particularly problematic country? No, they just happen to have the world's best surveillance. So started in Africa, hard to say where, Botswana probably. But there again, we're now finding so many cases, say, from Nigeria. So it could have started in Nigeria. I think we can safely say it probably started in the southern half of Africa. But Denmark has picked it up really quickly because of their the best. They've got the best surveillance in the world. Danish Serum Institute. The time we gain, hopefully by delaying things a bit with the Omicron, we must use to get as many people vaccinated as possible. So Denmark very much pro-vaccine there. That's a direct quote. And this is a direct quote from me. And the shots will be aspirated in Denmark because they're doing it properly. And we're hoping to get comparison data as soon as I get the time to work on that. Now, what other people are saying... This is Dr. Jeffrey Barrett, Director COVID-19 Genomics Institute, Wellcome Sanger Institute. So these have been involved heavily all the way through. Omicron spreading faster than Delta, he agrees. UK's dominant variant within a matter of weeks, he agrees. So basically everyone is saying this is what it's going to be now. It's too early to make the assumption on severity. Now, he's saying that it's too early to make the assumption on severity. So if Dominic Raab, the Deputy Prime Minister, if he's wrong, a lot of people are going to die. If he's wrong. If Jeffrey Barrett's suspicions are even partly true, we've got problems. And not just here, all around the world, everywhere. I think we're okay. I think the human race has just been phenomenally, unbelievably fortunate, because if this was a really nasty mutation that made people sick, doesn't bear thinking about, because we wouldn't have stopped it. It would have carried on anyway, and it would have carried on killing people. I think we've just been phenomenally fortunate, but we don't know that yet for sure. This is based on preliminary data. We need more, as Dr. Jeffrey Barrett correctly and scientifically cautions. If only a small proportion of people get seriously ill with Omicron, a small fraction of a really big number can still cause problems. So a lot of people are going to be infected in the next few weeks. Tens of millions of people, probably billions of people are going to be infected with Omicron in the next few weeks. If it does turn out to make people sick, then we can't cope with these large percentages. Let's hope my original analysis of the South African data is correct. Professor Paul Hunter, new variant could spread faster than the current dominant variant. So again, basically everyone's agreeing now. We'll probably start to overtake Delta within the next few weeks. Again, Professor Paul Hunter, of course, we've talked to before. Now, Tim Spector, King's College London, and Zoe, Professor. Again, we've been pleased to have him on the channel a couple of times. UK Omicron, probably at least 1,000 to 2,000 cases. Not what was the official number? Was it 300 and something? Anyway, way more than the official number. New variant can only be picked up by 30 to 40% of the PCR tests. This is rationale there, and that makes perfect sense. So not all of the PCR tests that we're using in the UK test for the S gene. And the reason that we suspect a PCR test is Omicron is the S gene deletion. But of course, if the F gene is not tested for, it can't be deleted. So we can't really differentiate between Delta and Omicron on all of the PCR tests, only on 30 to 40% of the tests at the moment, which means, of course, we're greatly underestimating, because genomic analysis is only picking up a very small fraction of the positive cases, even in the UK. Denmark is picking up a higher proportion. Symptoms from Omicron appear at the moment to be more similar to a cold. Let's hope this continues to be the case. If not, we've got big problems. Tim Spector says, rather than the classic symptoms of high temperature, new continuous cough, or loss of sense of smell. Let's hope Tim Spector is right. This means cases may be missed, of course, at the moment, and Omicron cases are doubling around every 2 days. Wow. Tim Spector believes they're doubling every 2 days. And he, of course, is a genetic epidemiologist. Wow, every 2 or 3 days I think we can safely say numbers are doubling. Let's hope it's not going to make people sick, because a lot of people are going to be having this infection all at the same time in the next few weeks. If 0.25% of them get sick, we've got problems, because so many people are going to be getting it all at the same time. Someone called Anthony Fauci on Omicron. Thus far, it does not look like there's a great degree of severity to the Omicron variant. Let's hope he is correct. But we have really got to be careful before we make any determinations that is less severe or it doesn't really cause any severe illness comparable to Delta. So that's what he thinks. It's probably true from what I can gather. And then he goes on to well and truly hedge his bets. Let's hope he's right on the first part. I mean, it's pretty obvious, actually. It's likely to be less severe, but it might not be, is what he's saying. Well, that's not too impressive, actually, saying it's probably less severe, but it might not be. Doesn't really tell you anything very definitive at all. Mayor Bill de Blasio, New York, of course. All New Yorkers will need to be vaccinated if they want to go to work. Part of the response here. Public sector employers are ready. It is mandated. Mandate will now be extended to all private sector employees in New York and surrounding areas. I'm not quite sure how far Mr. de Blasio's jurisdiction goes, but I understand it's all of New York City and quite a bit round about it. From the 27th of December, this is going to affect 184,000 businesses. 10 cases of Omicron so far in New York, which of course means there's a minimum of 10. There's likely to be a lot more. Mr. de Blasio points out holiday gatherings, cold weather, should be assumed that, so these are going to increase spread, in other words, it's bound to spread. Should be assumed, so community spread should be assumed already in New York. So Mr. de Blasio is saying it's already spreading in New York, almost certainly needs to be assumed. A few places mandating already in terms of businesses in the States, but of course, as you would expect in the States, there'll be the indignity of legal proceedings. President Cyril Ramaphosa, South Africa, we're experiencing a rate of infection that we've not seen since the pandemic started, for sure. End of quote. Now, I am looking very carefully at hospitalisations in South Africa, getting all the data we can. Hopefully there'll be an update on this shortly. There's nothing that's jumping out to cause massive alarm at the moment. The popular press, mainstream media do seem to be misunderstanding quite a few things. But I'll just comment on that briefly. I don't want to do too much without data. But what we're seeing is a lot of people in hospital in South Africa are testing positive for Omicron. But I think this is just reflecting the population as a whole at the moment. I think it was 76% of cases were incidental findings, the data we looked at already from South Africa. But if everyone's got Omicron, if it's just spreading to the whole population all of a sudden, and we have been looking at provisional data as well, saying Omicron is virtually now the universal variant in South Africa, then it wouldn't be surprising. So it doesn't tell us too much. I'm still really, really hoping that people aren't going to get sick. And it's just gone everywhere else. Argentina, first case on Monday. Brazil, Mexico, Chile, Russia. First case confirmed on Monday. 10 people testing positive from South Africa. 2 had the Omicron variant, so it's already in Russia. Asia. This is just as people are picking it up. India, 21 cases, so it's everywhere. So the next few weeks, until we are definitive on this, are going to be pretty tense. Governments have not prepared for the rate of spread. If it did turn out that this variant is going to cause a lot of deaths, then it would have been bad, because governments have done nothing to stop it. Nothing that's nothing that's anything like commensurate with the transmissibility of the virus to stop it. But I'm still optimistic that the data we have is showing that people don't get sick. But of course, we don't know for certain yet. Optimise your immune system, get your vitamin D in, have good nutrition, because I'm afraid you are going to be exposed to Omicron soon, as am I. Thank you for watching.